Ladies and gentlemen, now we are going to the next sections on the topic of points of entry, capacity building, presented by Dr. Richard Brown from the World Health Organization Country Office. Please join me in welcome all of the speaker. Thank you.
ครับขอเสียงยินดีต้อนรับนะครับขอเสียงปรบมือนะครับผมให้กับดร.ริชาร์ด บราวน์นะครับผมวันนี้ท่านจะมาบรรยายในหัวข้อเรื่องของกฎอนามัยระหว่างประเทศนะครับในการเสริมสร้างสมรรถนะของเจ้าหน้าที่ช่องทางเข้าออกระหว่างประเทศนะครับผมมันเป็น WHO ประจำประเทศไทยนะครับผม
So, good morning, everyone. I apologize. I will be speaking in English also, but I think there are more headsets if anyone wants to listen in Pasay Thai. So, thank you for providing an opportunity for me to say a few things about what WHO recommends around points of entry and the kind of approach you can take towards assessing your capacities, identifying gaps and addressing them. So it's about, I think 28 or 29 slides, but some of them are quite detailed. Do I need, yeah, okay. Maybe I need to ask someone else to advance the slides. I think there was one before this. Can you go back? Okay. So this is just a quick overview of what the presentation will cover. So I'm going to say something about the international health regulations, then some detail on what the IHR says about the need to formally designate points of entry, and then to talk about capacities at points of entry. Then number 4 is about a monitoring and evaluation framework that WHO has developed and how this applies to points of entry. And then lastly, just to share some lessons from the response to COVID-19 in the context of border health and international travel. So probably you know this, but the International Health Regulations, or IHR 2005, is an international legal agreement which helps countries to work together to prevent, protect against, control, and provide a public health response to the international spread of disease in ways that are, it's quite complicated language, commensurate with and restricted to public health risks, and which avoid unnecessary interference with international traffic and trade. And as you know, it's sometimes quite difficult to get a balance between a country trying to protect itself, but also trying to facilitate free passage of individuals and goods. This current version of the IHR was adopted in 2005, but it only really came into force in 2007, and it is legally binding on the 196 WHO member states. And before this version of the IHR, there were other versions of the international health regulations, and before that, something that was known as the international sanitary regulations. But this version of IHR is quite different from what we had before in a number of ways. So firstly, before older versions of the IHR referred to a specific list of diseases that were considered to be important. In fact, this version of the IHR does flag some specific infectious diseases which are of really important significance. But it concentrates a little bit more on the detection and reporting of certain types of event that will fulfill a number of criteria. But particularly in the context of what I'm talking about today, one of the most important differences about this version of the IHR was that it required countries to develop these minimum core public health capacities. So it said, according to a timeline, you really need to have these basic things in place, every single country. And if every country has these minimum core capacities, then as a world, we are much safer. The third one in this list I've mentioned already, but countries are required to notify events that may constitute a public health emergency of international concern. And we use this acronym, PHEIC. Then the IHR also authorizes WHO to use unofficial sources of information and to make a request for countries to verify the information. So you may just hear about something from a media report in a country, and then we have the right to request that country to confirm or, say why this is not a genuine event. It also allows WHO to declare a public health event of international concern and issue some temporary recommendations. It also, compared to previous versions of the IHR, the current one puts a strong emphasis on the protection of the human rights of people and travelers. And it also, importantly, called for the establishment of national IHR focal points and WHO IHR contact points. In fact, the IHR focal point in a country is not a person, it's an institution. So for Thailand, the national IHR focal point is the Department of Disease Control in the Ministry of Public Health. But we also have designated people who are, if you like, the kind of liaison. Okay, so what does the IHR say about points of entry? Firstly, it defines 3 different types of points of entry, as you might know. So firstly, there are airports. Secondly, we talk about ports, but it really means a seaport. And the third are ground crossings. And these are dealt with a little bit separately. So airports and seaports are covered by Article 20 of the IHR, which says that state parties shall designate the airports and ports that shall develop the capacities provided in Annex 1. So what this means is that countries were asked, based on certain criteria, which I'll come to designate a certain number of airports and seaports. And when they designated those places, it meant that they were required to develop these minimum core capacities at each one of these designated points of entry. And then on ground crossings, it's a little bit more flexible, but the IHR says when it's justified for public health reasons, a state party may designate ground crossings. And if they do that, they also need to develop these capacities. So what are these criteria? So for any point of entry, you should think about the population density. So how, are there a lot of people living around this point of entry? What is the epidemiological situation around the point of entry? Is it somewhere where we know there are a lot of dangerous infectious diseases? Also to consider the volume and frequency of international travel and the type of transportation. Also, what are the public health risks in the place of origin and transit of international traffic? So, you know, there's a difference between an international airport and a domestic airport. And it may be that you know that your international airport receives passengers traveling from countries where there are dangerous infectious diseases. Also, it's important to consider what the existing capacities and facilities are to manage public health risks. And lastly, countries were asked to maybe consider joint designation of a point of entry with a neighboring country. And there are a few examples of this. So, for example, I think in between the United States and Mexico, at the point where there is the biggest volume of traffic, it's actually a joint designation as a point of entry between Mexico and the United States. So, and I think this is something that Thailand might wish to consider, you know, having a joint designation maybe with Laos, Cambodia, or Myanmar or Malaysia. Next, I'm just looking at the table on the left-hand side, which is just a summary of the number of designated points of entries by type globally. So overall in the world, there are 744 seaports that are designated. There are 645 airports. There are 734 ground crossings. And there are totally 125 states parties or countries that have ports that are authorized to issue ship sanitation certificates. Sorry, I thought this slide set was animated, but it's not showing like that. But so if you see the animation of the slides, it starts off by showing that the core capacities that are required at all times. So there are certain things that you need to have in place every day, you know, just routinely, every time an aircraft arrives, every time a ship arrives at a port, every time goods cross an international boundary, there are certain things that you need to do just as part of your everyday business. But there are also additional requirements that a point of entry needs to have when responding to any event that might constitute a public health event of international concern. And one of the examples that is flagged later in this presentation is the need to have a contingency plan for your point of entry, or what you would do if a significant event occurs. But what is common to both of these requirements, the kind of normal one and the emergency requirement, is that you need to have really good coordination, communication of event information. Sorry. And you need to be prepared to adopt measures according to your assessment of risks. So again, this slide is supposed to be animated, so it goes one by one. So I believe it starts off just showing one of these boxes. But this is trying to explain in some detail what is required in terms of coordination and communication. So if you, I don't know if this has a printer as well. Maybe if I can come to here. So for sure, your point of entry needs to have an international communication link with competent authorities at other points of entry. You know, your public health function at this airport in Thailand needs, if necessary, to be able to communicate with points of entries at international airports in other countries. You also need to have a national communication link between your point of entry and the health authorities at local, intermediate, and national levels. So you need to, you know, be able to report to the provincial public health authorities in Samut Prakan, but you also need to have this link to the Department of Disease Control. You need to have an operational link with other senior health officials. You need to be able to talk to conveyance operators. You need to be able to communicate to travelers. You also need to have a link to service providers. You need to have the capacity to assess all reports of urgent events. You also need to have a mechanism for communicating with WHO to provide information, but also to receive recommendations. And also underpinning all this is that you need to have procedures and legal administrative provisions to conduct inspections, receive reports of cases of illness, and other evidence of public health risk on board arriving conveyances. So, even an incoming airplane will need to have a point of contact if they have someone on board who's unwell. So all these communication functions are really critically important. And it makes me realize that what you do in points of entries is really important, but it's also really complicated. And so what this presentation does is, instead of talking about all these, it just picks out one as an example. So the next slide is really just focusing on this part, the national communication link. So just to drill down a little bit of detail about one of these communication components. This is a slide which is talking about the communication between points of entry and the health authorities. So what WHO say is that the capacity that needs to be assessed is a national communication link between competent authorities at the point of entry and health authorities at local, intermediate, and national levels. And the things you need to take into account, consider, are firstly, but all the stakeholders that you need to think about in terms of this communication. So it is the public health authorities at these different levels, but also any other relevant government ministries, agencies, government authorities, and any other partner that's involved in POE activities. So I guess one example is the people who own and run the airport, but also Thai Airways. They're really important stakeholders in this communication. And you need to make sure that contact details are shared and regularly updated and clearly documented. These communication procedures also need to be written down, agreed through something like a memorandum of understanding, and you need to have protocols and standard operating procedures that you've tested. But also importantly, there needs to be communication between the point of entry and the national IHR focal point in order, when necessary, to inform us, WHO, within 24 hours if there is a relevant report of a human case of an infection, or if you've discovered an important vector which is carrying an infection, or even sometimes when you've discovered some contaminated goods. And then this next slide, so we've talked about communication. This slide is about the core capacities that need to be in place all the time, just part of your everyday business. So again, I'm gonna show the pointer. So what are these everyday core capacities? Firstly, you need to have medical services and enough staff to allow for the assessment and care of travelers who are sick. You need to have equipment and personnel to support the transport of these travelers. You need to have trained personnel to inspect conveyances. You need to have a safe environment for travelers at all your facilities inside the point of entry. And you need to have staff and programs for vector control. And then I think the next slide, the reason why there's this red circle is just drilling down on equipment and personnel. So what does this mean? The assessed capacity is you need to provide access to equipment and personnel for the transport of ill travelers to an appropriate medical facility. What does this mean? You need to have equipment to transport people, an ambulance, typically. You need to ensure that there's access to PPE for transport staff. You need to have enough people to be able to do this safely. And you need to train these staff and document the training so that they're very familiar with all the standard operating procedures. And then maybe to just drill down on one more, which is about a safe environment. What does this mean? So in this case, when the detail is elaborated, an assessed capacity, this box here, is that it's important to ensure a safe environment for travelers in all your point of entry facilities. So you need to have drinkable, safe water supplies. You need to have places where people can get food to eat. You need to have flight catering facilities, public washrooms, arrangements for waste disposal. And you need to have a process, systems in place to conduct inspections. And you also need to have, properly trained and adequate numbers of staff to be able to do all these things. So what this means in detail is, firstly, a documented, tested and updated water safety program, which is conducted or is under the supervision of the competent authority. You need to maintain records, and testing results need to be documented, including treatment of water, safe sources of water, and water quality monitoring. For food, you need to have eating establishments, food suppliers, production stores. They also need to be under the Relative Health Administration, and this includes flight catering facilities. So the companies that provide food that go on the airplanes for people to eat. You also need to have public washrooms, toilets that are enough to cope with the volume and frequency of travelers. They need to be in good condition. They need to be inspected regularly and cleaned. And then lastly, there are requirements, as I mentioned, for solid and liquid waste disposal that need to be maintained and overseen. Then this next slide is, so we've talked about communication. We've talked about the normal everyday operation at a point of entry. Then this slide is talking about what happens when something really kicks off. If there is a public health event of international concern or an outbreak, what do you need to have in place so you can scale up your operation? So again, I'm going to use this pointer. So I've mentioned already that every designated point of entry needs to have a public health emergency contingency plan. You also need to have to provide for assessments and care of affected travelers or animals. You need to have capacities and facilities to interview suspect or affected persons. You need to be able to perform assessments and undertake quarantine of suspect or affected travelers. Also to apply any recommended measures, any additional recommended measures to disinfect and decontaminate baggage, cargo, etc. You may need to apply entry and exit controls. And you may also need to have additional capacities to transfer travelers who may be infected or contaminated. So really, this is what you've been doing for COVID for the past couple of years, and what you're also doing now for in the context of importation of possible monkeypox. And then I think the next slide is just drilling down on one of these, which is the Public Health Emergency Contingency Plan. What does this mean? So a contingency plan is really there to allow for an appropriate public health emergency response by establishing and maintaining a public health emergency contingency plan, including the nomination of a coordinator and contact points for the relevant point of entry, also public health and other agencies and services. So when you're undertaking an assessment, what does this mean? You have to ask, is there an agreed, updated, documented plan which is integrated with any other public health response plans, either at national, intermediate or local level, but also integrated with other emergency operational plans at the point of entry. So really this is just a public health emergency plan, but the airport has plenty of other emergency plans for, you know, contingencies like an air crash or a fire in the facility. And all these plans need to have some degree of integration. But secondly, is there training? You know, you have this plan, but is there periodic training and exercises to familiarize the contact points of all the key sectors and services that are listed in the public health contingency plan, so that everybody understands their respective roles and functions. And then just one more component that we drill down on is this need to perform assessments and to quarantine suspect and affected travelers. So in this case, what we describe as the assessed capacity is that you need to be able to provide for the assessment and, if required, quarantine of suspected travelers, preferably in facilities away from the point of entry. That's not always practical, but ideally it should be in another location. What this means in practice is you have to ask, are arrangements in place with local hospitals or other health facilities to receive suspected travelers from the point of entry so that they can be isolated or quarantined. But also you need to have arrangements with other support services. And to allow you to do this, you need an appropriate number of trained personnel at the quarantine facility who have the knowledge to recognize disease symptoms and who are also familiar with the procedures and measures that you'd need to apply to a traveler who has any suspected infectious disease. So if I just go back quickly, you know, we're just drilling down on some details, but every single one of these boxes, there are also a number of requirements, but we just don't have time to go through them all. But to help undertake these assessments, there are useful, I hope, WHO documents. And this is a key one. So this is an assessment tool for core capacity requirements at designated points of entry, covering airports, seaports, and ground crossings. And the objective of this guideline is, you know, firstly, to determine the current status of existing core capacities and to identify gaps, as well as system requirements to accommodate the implementation of the IHR. So what this implies is that you obtain baseline information, you undertake an assessment, you look at what you have, and this is what helps to identify the gap. And then this also allows you to develop a plan to address the gaps, you know, and your plan should have a timeline. It should have also include arrangements to track your progress towards filling the gaps. So it implies some kind of monitoring and evaluation framework. So the development of a plan of action should help to improve routine risk management, early warning, and response systems. And this is what allows you to meet the requirement of the IHR. There is also a kind of higher level monitoring and evaluation framework developed by WHO, partly so we can help to monitor what's going on at in countries so that we can report globally. So it just facilitates making information available, partly so we can plan to provide support, but also to share this information so all countries can get a kind of a snapshot of what's going on in the world. And this IHR monitoring and evaluation framework is a little bit complicated, but it has 4 main components, of which only one is mandatory. So the IHR requires reporting of a kind of a data set on a yearly basis. And this is what we call the State Party Annual Reporting, or SPAR, S-P-A-R. The way this works is that it's a self-assessment, and it's recommended that countries bring together the people they need to do this assessment. They have an in-depth discussion. It may include structured site visits, and then there's now the reporting is done online through this web-based tool. The second component is an IHR joint external evaluation, which is voluntary. But as you may know, Thailand undertook a JEE in 2017, and there is one planned for later this year. And the second 2 components, the ones at the bottom, the intra or after or intra-action review and the simulation exercise, again, they're voluntary, but they are quite important because they assess really the functionality. So you may have good arrangements in place, but it's important that they actually work, that everything fits together and is functional during a genuine emergency. So this is what this SPAR, State Party Annual Reporting, looks like. So there's a document, but there's also an online portal where the results can be entered. And border health and points of entry is one of the 15 technical areas that are covered by this version of the SPAR. Again, this is a slide with quite a lot of detail, but I think there are like 3 sub-indicators for points of entry. The first one are these core capacities that are required to be in place at all times. And I've mentioned these already, so I won't go into the detail, but just countries are asked to report progress in implementing these capacities. And you'll see there's a kind of a traffic light system. So once you get to level 5, it means basically you have everything that's needed, but then you still need to be able to maintain these. And countries do sometimes go backwards. Then the second sub-indicator is more about what happens when an event occurs. Do you have the capacities at your point of entry to respond to an event if it occurs? And again, I've already mentioned this, but it's reporting on an annual basis according to this traffic light system. And then I might just skip this slide, but there is actually now a third component which has been added based on the lessons learned from COVID. So what were these key lessons? So what COVID showed is that it is necessary to gather information on a regular basis about what happens during an event and what it means for a point of entry, so we can add to the evidence base of the effectiveness of interventions and the impact of travel measures. So I think what we saw during COVID was, frankly, it took everyone by surprise. And we found that maybe there are some components of the IHR that need to be seriously looked at. But what happened was that countries started introducing measures almost on an ad hoc basis. based on the best evidence that they had at the time. But I think it's really important that we look at what was done and try and learn as much as possible from it. I think another really key finding from the COVID response was about how complicated this multi-sectoral collaboration is. So we need to have better arrangements to work across sectors and formulate decisions about travel measures. It's important that the Ministry of Health, the Ministry of Public Health, is at the table in this intersectoral discussion to make sure that that the best possible public health evidence is available to drive decision making. But all relevant sectors need to be involved to bring in their kind of operational perspective. Lastly, it's really important that any decision that is made is based on risk. So we need to apply a risk-based approach to any measures that are introduced or we're considering to introduce. But it is interesting that countries seem to have a big variation in the level of risk that they're prepared to tolerate. So some countries just completely shut down their borders, and others had a much more kind of flexible approach where they regularly titrated the measures against the possible socio-economic impact. And I think that's what we saw from Thailand. And part of this was that they applied this so-called precautionary principle in a different way. So as a result, there is now a third indicator which has been added to the SPA, which is about a risk-based approach to international travel. And I will go through this. So this was agreed in 2021 by a technical working group who were asked to review the IHR Ebony framework in the light of lessons learned. And what this indicator suggests is there has to be a national process that determines the adoption of international travel-related measures. This process has to be multi-sectoral. It has to take into account a risk-based approach to the implication of such measures. It needs to be underpinned by guidelines and standard operating procedures for implementation. It needs to be developed and implemented at national, intermediate, and local levels. And these arrangements also need to be exercised, reviewed, evaluated, and updated on a regular basis. So I think this is the last slide. So they're just takeaway messages. So firstly, just to summarize, states or countries are obliged, as defined by the IHR, to develop these minimum core public health capacities at designated points of entry. This designation process helps authorities to direct resources to the points of entry that are more relevant from a public health perspective. Designated or any point of entry that is formally designated needs to develop core capacities that should be available at all times, but also for when you need to respond, to step up and respond to a public health event of international concern. And these also require these cross-cutting coordination and communication capacities. And it is important to test the functionality of these capacities on a regular basis, for example, through a simulation exercise. Then the assessment of these capacities informs the overall score of a country in the SPA. Then lastly, the COVID-19 pandemic has resulted in the addition of another indicator to measure the institutional multi-sectoral capacity of a country to apply evidence and risk-based international travel measures and to review and update them on a regular basis. So this slide just has the same thing in French language. And these are just some of the resources that are available, the guidelines that WHO, together with partners, has developed. Yeah, and this is the last slide. So thank you for your time.